This is my audience. Oh, sorry. In the final hour of my shift as a CNA, I faced a critical situation when Mrs. Garcia, my patient, had a fall. Quickly, me and my nurse rushed over to help her. Immediately, my nurse, fearing for her health, asked me to take Mrs. Garcia's vitals. Taking vitals is an easy and important part of a CNA's job. On average, I can take 1 to 4 vitals a week. Looking at vitals helps healthcare professionals see if there's any dangerous information about a person's heart, lungs, or blood flow that they need to be concerned about. Today, I will be showing my audience how to quickly and accurately take a patient's vitals. First, we'll be doing temperature. Temperature is taken with this machine, however, there's multiple types. The one I'll be doing is through her forehead, just to get that. However, there's some for under the tongue or under the armpits. So, what I'll need to do is I'll need to ask, can I put this up to your forehead? Yes. With permission, I'm going to just set it there. And when it's there, I'm going to be pressing this yellow button right here, which will give me the number. Right now, I have a number of 98.2, which is pretty good. And I'll want to inform her that her number is healthy to make her feel confident. So, Ms. Garcia, your number looks pretty good. Right now, we're going to move on to pulse. So, pulse will be taken with her radial artery, which is going to be along the thumb side. Here. And what I'll be doing is I'm going to use my index finger and my thumb and my index finger and my middle finger and place it on her artery and count to 1 minute. However, for time, we'll be doing 15 seconds and timing it by 4. So what I'm going to be hearing is I'm going to just be hearing little pulses. And on average, there's about 60 to 100 a minute. So with 15 seconds, I'm going to times it by 4 and get an accurate number. All right. So what I got was there 21 beats, which would give me about 84, which is pretty good. And again, I'll inform her. You have 84 for your pulse, which is a really good number. We like that. Next thing I'll be doing is oxygen. Oxygen, similarly to pulse, I'll be using the watch and a number and count how long it is. However, I don't want to tell her that I'm going to be taking her oxygen, because what patients will do is quicken or slow their breaths in order to get a number we'd prefer. So I'm going to place my hand back here, and I'm going to be pretending to be looking at her wrist, but I'm going to be counting her breath for about 15 seconds. Well, I'll be looking here. The average is about 12 to 20, so I'll be wanting about 3 to 5 for the 15 seconds. And again, I don't want to tell her just so she won't stop breathing her breath. So what we got there was about 4 really good breaths. So I tell with timing by that 4, which would be 16, which 16 is in between 12 and 20. So you have a really good respiration rate too. Finally, I'm going to be taking blood pressure, which I'll be needing a couple equipment. Let's see. First, I'm going to use this blood pressure cuff, which is going to go around her forearm right here. What I want to do is where it says artery, I want to place it right along this indent in her elbow. And I'm going to hook it up to her, type it there, and then I'm going to place my stethoscope, which I'm going to put in my ears, right on the indent in her arm, right here. And what this is going to be, this is a manometer, and what it's going to do, I'm going to pump up this number, and it's going to tell me, I'm going to pump it up to about 160, and I'm going to let air go out slowly, and it's going to tell me your systolic, which shows how well blood is flowing from her body, and her dystolic, which is telling me how well the blood is coming back. So, to pump it up, I'm going to be pressing this while keeping this here. And I'm going to have this turned all the way over and start pumping. And what I'll be listening here is for little beats in her pulse. And when I do that, I'm going to stop taking the air out. I'm going to go very slowly taking air out. And I'm going to keep taking that air out until I stop hearing that beat. So I hear it about 114. And I heard it stop at around 754. So that would mean her systolic is 114 over 74. finally, I would tell my patient, that's pretty good. And I'd say, all right, we're done with your vitals. Is there anything else I need to do with you today?
No.
No? All right, you're free to go. So my whole goal there is to make her feel comfortable and relaxed. As shown, that is how to accurately and quickly take a person's vitals. To take vitals, you need both the necessary equipment and demonstration skills to calmly talk to your patient and work through it. As explained, vitals is not only an easy job for CNAs, it is a way to help save someone's life. So remember, when you're getting your vitals taken, they're not just counting numbers. They're saving your life, one beat at a time. And once again, thank you to my audience for helping me out and listening. And thank you for watching. And thank you, my patient, once again.